Hi, I'm Jeanne Sarnosky, and I'll be your host today for our fourth installment of Cape Cod Health News, a health information TV program brought to you by Cape Cod Healthcare. This program has been developed to bring you health information you can really put to use in your daily quest to stay happy and healthy. I'm standing outside the Falmouth VNA office. Our specially trained teams offer IV therapy, wound care, ostomy care, pain management, telemonitoring, oncology, palliative and hospice care, home health aides, and homemakers. In today's program, we'll be taking an in-depth look at the Cape Cod Healthcare Blood Center at Cape Cod Hospital and their new platelet donation program. Later, we'll be discussing the Watchman implant device for patients with AFib with Dr. Peter Friedman, and we've prepared a segment on the Heart Failure Clinic in Hyannis with Dr. Elissa Thompson. Have you ever wondered what it must be like to go into patients' homes to deliver care? It's much different than providing healthcare anywhere else. We had a chance to follow Andrea Fichter, a registered nurse from the Visiting Nurse Association of Cape Cod, in a segment we like to call A Day in the Life of a Visiting Nurse.
I'm Andrea Fichter. I'm a case manager with the VNA of Cape Cod. I've been with the VNA since October 2014. So I grew up in Texas. My family still lives there. They live in Alvin, Texas, which is right outside of Houston. When I finished high school, I moved to Austin, Texas, and I met my husband at this, we like to tell our children we met at church, but it's a little place called 6th Street, which is sort of famous in Austin. So we lived in Austin for a little while. He finished his college degree at Texas State University. He's a law enforcement officer. He's a police officer in Yarmouth. I grew up in a house, like a multi-generational house when I was 10 years old. My grandparents moved in with us. We turned our garage into like a little one-bedroom apartment for Mama and Papa. And my grandfather had Alzheimer's disease, and my grandmother was not going to put him in a nursing home. The local visiting nurses really helped keep him in the home, and he died in our home, and so did she. So that's why I always wanted to be a visiting nurse, so that I can help people stay in their home and not be separated from their loved ones. And this is probably my most driven road, Setauket Road. I think I probably drive this road like 20 times a day, because I can get to my house from here, and then the office is here, and then my kid's bus stop is on this road. So me and Setauket Road, we're like this. I will call all of my patients, and I'll get in my car, and I'm already in my car if I've just dropped my kids off at the bus, and I'll go back to the office if I need supplies. If not, I'll go to my first visit and start my day. In the summertime, I could probably put 40 to 50 miles a day, and I just stay in Yarmouth, Yarmouth, Dennis. But there are some days where I'm like today, after I see my first patient, I'll be at Heatherwood. So I'm putting miles on my feet. And the other fun thing that's different from working in a hospital versus VNA is all the fun turkeys that are on the road. It's multitasking. You have to pay attention to the road. You have to know where you're going. You have to answer doctor's calls. You have to maybe you can't, you need to find a place to pull over to do work. And supplies, it's difficult. at a hospital, you can just go to the supply cabinet and voila, there it is. Sometimes we're like master improvisers. GPS is our friend, we always have to know where the clean bathrooms are. We have to just kind of park on the side. All right, the call center called me. They're leaving a message. We'll check that later. I'll never forget when I was taking vital signs on this lady. She had a pet bird, and she was an Alzheimer's patient, so it was like her therapy bird. And I would be going to take her heart rate, and this bird would be like leaning forward to bite me as I'm touching her. Hello.
ladies here, we can start.
Okay. Hi.
Hi.
You're staying in here, huh?
Yeah. Yeah, we're just finishing up the energy audit.
There he is. What'd you do? Bar fight?
I lost.
You lost? I haven't seen you since the 15th.
Last week?
Seems so long ago.
Yeah.
It's their home. You know, they don't have to. That anybody can refuse. It's a privilege. You get to know these people. You can really help them in less of like a clinical setting like the hospital. It's more like you really see what's going on and you can really see how you can make a difference.
Right. That was the first thing I learned. Yeah.
And all of my fabulous teaching, don't forget. Well, we can go in there and say, well, it might be these peanuts that you're eating every day. Or, you know, you didn't realize that this can of vegetable soup you think is so fabulous for you has, you know, 2,000 milligrams of sodium in it, and your heart can't pump enough to get rid of that fluid and you're back in the hospital. Thank you very much
Oh, thank you.
for your kindness.
Thank you.
And you know you're going to watch for any warmth, redness, funny
Yeah.
looking drainage
Yeah,
there.
yeah, I am. Well, they told me what to do.
All right.
All right, honey. Thank you.
Okay.
All right.
See you next week.
I will.
You know, I've had patients say to me, you know, if it wasn't for you, I just know I would be in a nursing home. And I'm like, oh, thanks.
When we return, we'll visit the Bloodmobile in the Nicholas Zaros Blood Donation Center at Cape Cod Hospital.
Hi, I'm Jill and I'm standing in the Emergency Center at Cape Cod Hospital. If you or a family member experience any of the following symptoms: numbness or weakness of the face, arms, legs, confusion or trouble speaking or understanding others, trouble seeing in one or both eyes, trouble with walking, dizziness or loss of balance and coordination, severe headache with no known cause, please call 911 immediately and get to the emergency room.
I know you'd rather be anywhere instead of here. I know you'd rather be in your own home.
In your own bed.
But while you are here, I'm going to provide quality, compassionate health care to our neighbors and visitors.
We are the community safety net.
We are dedicated to you and your community.
Even if you don't love being here, we'll be here when you need us. We're going to take good care of you.
¿Quiénes somos?
Nos somos Cape Cod Healthcare.
Hi, I'm Regina and I'm standing inside the Falmouth ER. High blood pressure or hypertension is the leading risk factor for stroke. In the U.S. alone, more than 30% of American adults have high blood pressure. High blood pressure can damage blood vessel walls and over time cause them to weaken, which can lead to a stroke. Fortunately, high blood pressure can be controlled effectively. The first step is to have your blood pressure checked regularly.
When you donate blood, you give someone the gift of life. It's one of the easiest ways to make a big difference and help others. But blood isn't the only gift. Cape Cod Healthcare's Blood Center now includes a platelet donation program.
My name is Jonathan DeCoste. I'm the blood donor recruiter for Cape Cod Healthcare. And we're here today at Harbor Community Health Services for their blood drive. Annually, we need to collect around 7,500 units of blood to support the patients in need at our two hospitals. We only collect about 70% of those blood products, so anything else that we don't collect, we have to purchase off Cape. We're looking for a way to supplement our blood program and help expand the services that we can provide for hospitalized patients on the Cape. So we started with the blood program, and then we evolved that into the platelet pheresis program. It's very similar to donating blood. Come into the Cape Cod Hospital to donate. It takes about an hour and a half of your time, and we hope to collect around 1,000 units.
My name is James Happel, and I am the director of the laboratories here at Cape Cod Falmouth Hospital, and we are in the Nicholas Zaros Blood Center. We do about 1,000 platelet transfusions between our hospital here at Cape Cod and Falmouth Hospital in Falmouth. We are all part of Cape Cod Healthcare. And right now, we're looking to get to about 20% of that 1,000 that we do every year from collections here at the facility. And hopefully, by bringing in some new instrumentation and some additional staffing, and opening up the hours of operation here. Right now we're Monday through Friday 7 to 3. We want to try to go Monday through Friday 7 to 3 and then Saturday and Sunday from 8 to 4.
My wife's cousin, she convinced me to donate blood like about 3 or 4 months ago. And I was asking them, they suggested platelet donation. So I said, which one would be better? And they asked for if I could donate platelets, and they took a platelet count. And I said, sure, why not?
Sure. My name is Teresa Lauderhand, and I have been in blood business now for over 20 years. Started doing the platelets here, Cape Cod Health here a year ago. I love it. Kim and I actually started together. We love it. My training, I came from the American Red Cross, so I have an extensive blood donor background through their program, and came here to Cape Cod Healthcare 3 years ago.
My name is Kim Smith, and I have been here at Cape Cod Healthcare for 10 years now. I started off down in Florida at Florida's Blood Center, and I loved it. And I'm like, oh, that's it. I found my calling. And I've been in it ever since.
They can donate every 56 days for whole blood, and for platelets they can donate every 2 weeks. The stage that we're in is called priming, and what it's doing is it's actually bringing the whole blood up through the whole blood line, where it comes up, goes through a series of little filters, pumps, and rotors, comes back into the centrifuge. We ask the donors to be well rested, well hydrated, and they must avoid any and all aspirin or aspirin-containing products for 48 hours prior to donating platelets.
We need some more men donors, like Rich. We have a little bit more females than we do of males. What's great is we have the females coming out to do this, but we don't weigh as much as the men. And when we have the men and the bigger men, we could get 2 units off of them, as opposed to women who we only get 1 from, which we love. But we need to bump up the men a little bit more. We need a few more guys coming in to donate some platelets. So come on, guys.
Come on, guys.
I think a lot of people donate because they either know how good it is and how much it means to give back to the community, or they have a personal story. My son Jack, for example, was born. He'll be 10 in April, and he had open heart surgery on day 5 of his life, and he's had multiple transfusions during the course of his early childhood. Spent the first 83 days in the hospital and has had over 15 units of blood, 15 transfusions just to help him survive his ordeal.
A lot of people want to do their part as far as charity goes, and they can't afford it. You don't have to have money to spend on a charity to be able to help your neighbor or your loved one or a friend. It's a great way to give back to your community without having to come up with money and just a little bit of time. A lot of people at Christmas time, we tell them, you don't have money, just come donate blood. You're saving lives. What's the best gift other than saving a life? No better one.
And if anybody would like some information on how they can donate platelets here at Cape Cod Hospital, please feel free to call the hospital at 508-86-BLOOD, and we'll be able to direct you to the blood center and make appointments for you to come in and see us.
When we return, we'll learn about the Watchman implant device with Dr. Peter Friedman.
Hi, I'm Paramedic Dan, and I'm standing outside the Falmouth ER. A stroke is a medical emergency. A stroke can be diagnosed based on your signs and symptoms, as well as a physical and neurological exam performed when you arrive at the hospital. Once you are stabilized, your doctor may want other tests to determine the type of stroke, what area of the brain is affected, or to determine an underlying cause. If you think you're having a stroke, call for emergency medical services right away.
At Cape Cod Healthcare, we're a team.
In every one of our 88 locations across the Cape,
you'll find people to care for you 24/7.
There are nearly 5,000 healthcare professionals
dedicated to you
and your community. From Bourne to Provincetown,
Falmouth or Hyannis.
You'll have access to great care
wherever you are, whenever you need it.
Because we're not just a team, we're Cape Cod's home team.
We
are Cape Cod Healthcare.
Hi, I'm Christina, and I'm at the Emergency Center at Cape Cod Hospital. Cape Cod Hospital and Falmouth Hospital are designated as primary stroke service hospitals by the Massachusetts Department of Public Health. This means that a team of specialists is available 24/7 to provide emergency diagnostic and therapeutic services. Your care begins with EMS on the way to the hospital and continues in the ER when you arrive.
Welcome back. I'm at Heritage of Falmouth. This is the ideal place to live life to the fullest. It's a place where privacy, impeccable service, and an abundance of activities and programs come together to provide a truly exceptional assisted living. Atrial fibrillation, or AF, is a serious problem affecting over 5 million people a year in the U.S. Dr. Peter Friedman at Cape Cod Hospital.
It's the most common arrhythmia that we see in patients. And we're really in the midst of an epidemic of this arrhythmia because as people get older, it becomes more common. It's been estimated now that there may be 5 million patients in this country that have it, and that number is expected to grow to about 20 million by the end of the decade. So lots of patients with this problem. The issue with atrial fibrillation is that the upper chambers of the heart, instead of all the cells being activated at the same time and the two upper chambers contracting, when the patients are in AF, the upper chambers are just quivering. Every cell is being activated independently of every other cell, so there's no organized contraction in the upper chambers. The lower chambers are beating fine. They're going faster than they should, and they're irregular because they're being bombarded by impulses from above, but the problem's in the upper chambers. And the main problem with this arrhythmia is that because the upper chambers are quivering and not contracting, the blood can stagnate in the heart, and one can develop blood clots, which then can break loose and cause stroke. Stroke is actually the most common complication of AF, and the strokes that happen in these patients tend to be very large and very disabling strokes. So one of the mainstays of treatment of AF is a drug called an anticoagulant, also known as a blood thinner, to prevent the blood from clotting and to prevent stroke. And there are a number of agents that are available for this. The old standby, a drug that's been around for decades and decades, is a drug called Coumadin, also referred to as warfarin. It's very effective at preventing blood clot and stroke, but there are some issues with that drug that make it not ideal. So the blood clots that form a stroke are blood clots that form on the left side of the heart, because those blood clots can break loose and then enter the systemic circulation. And most of those blood clots form in the upper left-sided chamber, a chamber called the left atrium. And specifically within the left atrium, there's a little outpouching, if you will, a little balloon-like structure that's attached to the rest of the atrium called the atrial appendage. It's not in the mainstream of the blood flow, and there are lots of little nooks and crannies in the atrial appendage. So the blood that enters the atrial appendage tends to stagnate there, and that's where most of these blood clots form. It's been estimated that 90% of the clots in AF that cause stroke actually come from the left atrial appendage. The problem comes when patients are on an anticoagulant and they have a bleeding complication, or if they have a lifestyle that makes taking a blood thinner or an anticoagulant problematic. For example, someone who plays hockey or someone who's a downhill skier. You know, if you're taking an anticoagulant and you fall on the ski slope, that has potentially very serious consequences. So there's always been this desire to look for some other method of preventing stroke other than an anticoagulant, a medicine that someone needs to take all the time. And that's what led to the development of this new technology, this new device called a left atrial appendage occluder, also referred to as the Watchman device. If you can imagine, the device looks a little bit like an umbrella. And what we do is we go through the veins in the leg with catheters. We go up inside the heart. We're on the right side of the heart. We have to get over to the left side. The way we do that is to do something called a transseptal catheterization. So with a needle on the end of a catheter, we actually poke a hole in the wall that separates the right atrium from the left atrium, and then we can pass a catheter through that hole into the left atrium. Once we're in the left atrium, we advance the catheter into the atrial appendage, and then within that catheter we have folded up this Watchman device. We place the Watchman device in the atrial appendage and remove the catheter that surrounds the device, and as we remove that catheter, the device expands and actually sits in the atrial appendage and covers over the opening. Now, over time, about 45 days or so, the body actually heals over that device. So there's natural tissue that grows in and causes a permanent seal. And once that's done, then no blood can get into the atrial appendage and no blood clots in the appendage can get out. The FDA approved the device for routine clinical use a little bit more than a year ago. Now, we started doing it just late last summer. We've actually done 2 implants. We have about 6 or 7 other patients who are on the so-called launching pad who are ready to have it done. Well, right now there are strict guidelines about who can have it done and who can't. You know, the Center for Medicare Services, Blue Cross, Blue Shield, the other third-party payers still regard anticoagulant medication as the mainstay of therapy. And that's appropriate because the drugs are, for most patients, safe and well tolerated and very effective. Right now, the candidates for the Watchman are the patients who've had a bleeding complication on the medication, or who can't afford the medication, or who have some other compelling reason not to be on a blood thinner, lifestyle issues that we talked about. That may change over time as more and more of these devices are implanted and we begin to learn how effective they truly are. I can imagine a day not too far in the distant future where this device may actually become first-line therapy for many patients.
Fascinating. When we return, we'll be talking with Elissa Thompson about the new heart failure clinic in Hyannis.
I'm Jeanne, and I'm standing here in the Falmouth Hospital ER. Our exceptional team of professionals at both hospitals are trained in the diagnosis and treatment of stroke. Patients receive state-of-the-art care following a stroke, including, when appropriate, clot-busting medication that minimizes the damage caused by a blood clot.
At Cape Cod Healthcare, we all love our jobs.
We are always here when you need us.
24/7.
There are 88 locations
Across the Cape.
It's not just because of our cutting-edge technology
Or the latest diagnostic tools.
We work in state-of-the-art facilities.
We have superior outcomes that bring you greater value.
Sure, all those things are great.
But the real reason we love our jobs
is because our patients are also our neighbors.
We are
Cape Cod Healthcare.
Hi, I'm Michelle. I'm standing in the emergency center at Cape Cod Hospital. If you suspect that someone is experiencing a stroke, think and act fast. Face. Does the face look uneven? Ask the person to smile. Arm. Does one arm drift down? Ask them to raise both arms. Speech. Does their speech sound strange? Ask them to repeat a simple phrase, such as, "The Red Sox are your favorite baseball team." Time. If you observe any of these symptoms, call 911 now.
I'm at Falmouth Hospital outside the Clark Cancer Center. This 10,000 square foot facility was made possible through a $10 million donation from the late James Clark and his wife Ruth of Falmouth. It was built to offer close-to-home radiation oncology services to the people of the Upper Cape. The center continues to provide the latest cancer treatment to our community. The community-based heart failure clinic at the Cardiovascular Center in Hyannis, under the direction of Cardiologist Elissa Thompson, is a resource designed to educate and help patients maintain the best possible quality of life and manage their symptoms.
Congestive heart failure is one of the biggest reasons for hospitalization in our country right now, especially for patients older than the age of 65.
So there are 2 main categories that fall underneath heart failure. We see patients who have had prior heart attack or a viral illness that has reduced the capacity of the heart to work.
So we see that a lot with elderly folks who have high blood pressure over a period of time, or if they have diabetes, that's an independent risk factor for developing congestive heart failure or heart failure. It's the same term, interchangeable, but there are different types of congestive heart failure. All of them are characterized by a difficulty with breathing and a difficulty with the heart in meeting your body's metabolic needs. So your kidneys can sometimes suffer, you develop swelling in your feet and ankles, you can develop elevated pressures within your lungs because fluid backs up into the lungs.
So their first office visit is typically 90 minutes. In the course of that exam, they'll have medication reconciliation where we ensure that they're on the appropriate treatment. We'll do a physical exam to make sure that they don't need adjustments in their fluid volume pills.
Another symptom would be if people are suddenly waking up in the middle of the night feeling very unable to breathe and can't catch their breath, like they'd like to throw open the window and stick their head outside and get as much air into their lungs as possible.
Atrial fibrillation can be one of the causative agents that can exacerbate heart failure, particularly in those patients who have the form of heart failure in which the heart doesn't relax.
The mortality risk associated with congestive heart failure is quite high. If you're hospitalized with congestive heart failure, your risk of dying in the next 5 years of congestive heart failure is about 50%. And that's pretty significant. We've done a lot of work with cancer in our country, and we have reduced the mortality rates of many cancers to very low rates at 5 years. But with congestive heart failure, it's a very high rate of mortality.
When they're seen and then referred to us, we are then able to maximize their treatment with medications and lifestyle changes.
One of the major factors in the mortality risk associated with congestive heart failure is readmission with congestive heart failure. And we have a national epidemic of congestive heart failure in this country, and we are seeing very high readmission rates for our patients within the first 30 days.
I know our rehospitalization rates have certainly dropped since the clinic has been open. I think part of that is the group effort of having both community nurses as well as Dr. Thompson and the other cardiologists here to bring patients in and identify them sooner.
We spend an awful lot of time with these patients during their visits here. Shannon gives them a lot of counseling. I give them counseling. We talk a lot about diet. We talk a lot about what patients should understand as their symptoms and signs of developing worsening heart failure. We also have a pharmacist who can go into the patient's home and take a look at every single medicine they're taking and help give us information and feedback to help us streamline medication regimens, because we know that medications are both helpful and harmful, especially if they're confusing, which is often the case. We try to have case managers in the home to assess for any other needs that the patients might have, not just for congestive heart failure. They might have problems with wound care or diabetes management. They might have issues involving transportation. They might not have access to fresh food, and so we want to make sure that we're getting the patients all of the services that we can provide and bring to bear for them to help prevent them from being hospitalized again with congestive heart failure. I'd like to let everybody know how excited we are to be able to provide this kind of unique program to the patients in Cape Cod. It's a novel program. It's been wonderful to kind of step out of the box of traditional cardiology and traditional healthcare and be able to bring this special brand of healthcare to people in their homes.
Well, that's about all we have time for today. Thank you for tuning in, and remember, if you would like to help your community, give blood or platelets by calling the Blood Donation Center at 508-86-BLOOD. I'm Jeanne Sarnosky, wishing you good health and good health care.